afternoon. This is Ellen Thorne. I'm a program coordinator at Healthy Community Coalition in Farmington, Maine, and welcome back to MPHA's 2020 annual conference. I'm excited to be here today with Chris Lyman, a public health consultant, and Al May, a district liaison for the Down East Public Health District. Before we begin, I do have a few reminders. We are now offering closed captioning, which is accessible in the left-hand menu of the conference website. And please remember to take the evaluation, which is located on the session page where you entered the live stream. Also, if you have any questions for the speakers, please enter them using the Ask feature on the conference website, and I'll be taking them at the end of the presentation. And with that, I will turn things over to our presenters.
Thank you very much, Ellen. And thank you again to Becca and Heather for inviting Chris and I to do this presentation on public health competencies. And by the way, we also want to thank Frederick and his crew at Event Platform because they provided us great technical assistance. So today our talk is on public health competencies, a view from the field. And here is some of the objectives, or these are the objectives that we're planning to cover today. And I think you've all seen this if you read the abstract for this presentation. And Chris and I, as the presenters, have nothing to disclose with regard to commercial relationships. So I think probably some of you are probably thinking to yourself, what the heck is these public health competencies and why do we want to have a discussion or a meeting about these? And this quote from Healthy People 2030, we think sums it up pretty well. Let me read it for you. Every public health program requires health professionals who are competent in cross-cutting and technical skills, up-to-date information systems, and public health organizations with the capacity to assess and respond to community health needs. Just in those basic lines, you can almost see the essential public health services. You can see the whole idea. And this is not just a governmental approach. This is for any public health program. So we thought it's very important to have people understand what these competencies are.
So what's the value of actually going to get some public health training? You do get grounded in the competencies. Overall, it strengthens public health systems, the more people who share some of the same training. If you have a workforce development plan, it can help guide the development of that. It certainly supports quality improvement of the work. You can often insert the public health competencies into job descriptions. And it's helpful for partnership approaches when you have folks who have been exposed to public health. Certainly helps you in your organization developing grant applications when they see that you actually have a public health background of some kind. And there's a career pipeline that is developed. This is a field, so people can start all the way in high school with internships and various approaches, all the way up to big leadership opportunities. I threw in this slide because I thought that it was significant that when the National Association of City and County Health Departments conducted their biannual survey, that they asked in 2014, well, you are developing multi-sector partnerships. How many of them have a common understanding of the concepts, definitions, and principles across the partners? And in the tan or brown color shows that, yes, all of our partnerships, we have a common understanding among all our partnership organizations. On the other hand, there were also 15% who said some of our partnerships, there was a common understanding among all of them. And then it was a mix in terms of some and all. But the point being is the more people who share exposure to some of the key concepts, the more efficient and effective you can be. Okay. So what are these core competencies? Basically, they're a consensus set of skills for all sorts of areas within public health. And they're defined by the 10 essential public health services. And they were created by the Council on Linkages between Academia and Public Health Practice, which were 22 national organizations brought together to improve training and get more standardization, which they did by organizing all these different skill sets into 8 domains and 3 tiers of skills within each of the 8 domains. The first time they showed up were in 1991, and then later versions came in 2001, 2010, and 2014. And there's been a more of a plain language modification of the competencies, but the same competencies in 2017. And they're incorporated into Healthy People in the last 3 decades and the National Public Health Accreditation Standards.
So based on the last slide, we're going to just show you what these competency domains and tiers are. So they are organized around these domains, and these are the 8 here that are listed. And so let's just read through these. So these are the skill areas. You see they're fairly broad, and they would then be broken down into smaller subcategories. So the necessary skills are analytical assessment, policy development and program planning, communication, cultural competency, community dimensions of practice, public health sciences, financial planning and management, and leadership and systems thinking. So you may be thinking, geez, I work in public health. I've been working for a number of years, and I don't think I know what's the public health sciences. What's financial planning? Again, they're setting these domains up for a large group of people based on various skill levels, and as you see in a minute, as far as tier levels. The reason we're putting this here is because of the idea of connecting to the essential public health services. And in 2020, there was an update to the essential public health services. About a year or two of actually going through, having a number of people take a look at this. There was a task force formed, and people could vote online to what they thought about the revision. So this wheel here, instead of listing them all out for you, this wheel gives you a pretty good idea. First of all, what are the core functions of public health? And they're on the outside circle. So you see assessment, policy development, and assurance. And the word assurance sometimes gets misunderstood. Assurance from a governmental side perspective is accountability. So you're like a governmental public health entity in a state, at a county level, at a district level, at a city level, at the federal level, you're accountable to meet these essential public health services. The colorful wheel are the current or the revised 10 essential public health services, and they're not really that much different than the older ones. When the voting was done, people said, let's just revise them and tweak the language a little bit and bring them up to date. So they're not really changed much. The biggest difference is that middle circle. And so basically, because it touches all the essential public health services, this new framework wants all the essential public health services to touch on health equity. So you'll see that in the standards when they're out, that there's going to be a more of a health equity perspective to each of the public health services. So we talked about the competency domains, and here are the competency tiers. Again, trying to break out a way of looking at different levels of experience that people would have once they get into the public health field. And so tier 1 is the entry level. And this is frontline staff typically. And here's some of the responsibilities that they should be responsible in some of the skills: data collection analysis, field work, program planning, outreach, communications, customer service, and program support. The next level is a tier 2. And just like a lot of other tier type processes, a tier 2 person needs to, first of all, meet tier 1. So they should have all those skills. And in addition, they need to have these skills. And you'll typically see this at a program management or a supervisor position. And so they're the ones that develop, implement, and evaluate programs, supervise staff, establish and maintain community partnerships, manage timelines and work plans, and make policy recommendations and provide technical expertise. And finally, at the leadership level, which is tier 3, again, these folks should have both all tier 1 and tier 2 skills. Obviously, a lot of experience typically at senior management level, and they're really they're the visionaries people, but they also need to oversee the major programs or operations of the organization. They set a strategy and vision. They create a culture of quality, and they work with the community to improve health. The Public Health Foundation looked at the tier 1, the different tiers and the domains, and said, geez, let's really connect this to the essential public health services. There's a document that's actually shown at the bottom of this. The link to that document at the bottom, and you can basically find all the domains. So basically, in this case, we're looking at the domain analytic and assessment skills. At the top line is all the essential public health services, 1 through 10. And then these are more subcategories under analytical assessment. And having these skills, then they show basically where the X is of where you would use those skills in the EPHS, Essential Public Health Service. So example, first one, identify the health status of populations and the related determinants of health and illness. You're seeing that's consistent across all the essential public health services. So a person working in any of those fields of these health services should have that skill. Similarly, the second one, describe the characteristics of a population-based health problem. And then it goes down from there. We're just showing this to introduce this to you, but certainly this kind of document and this type of a graphic would be great in developing a workforce development plan for an organization. It could also be certainly used for performance management evaluation. Typically in a performance management, it's not just looking at the past year of your work, but you're also working with your supervisor to look at the future, the next year. And in that case, you can identify, these are the skills I want to work on the next year, and how do I get them? So you're seeing us in this presentation going from the typical public health practice field and looking across the board to a really important partner, and that's our education academic world. And so the Association of Schools and Programs of Public Health created a task force to really look at public health education for the 21st century. And here's a few of their recommendations. And they're fairly well, high level, but they really want to transform public health degree programs. And this is including the bachelor's degrees, the master's and doctoral level public health degree programs. They really want to look at people working across the silos. So public health needs to know what the clinical partners are doing. They also want to know about other professions that public health sometimes doesn't work with. Environmental folks, not environmental health, but I mean, we're talking about the environmental field. Regional planners, as Chris alluded to earlier. Some of those folks that we don't typically think that work in public health, but when you really look at the work they're doing, they're working in public health also. And of course, collaboration always comes up. And I think people really need to know that collaboration isn't just coordinating activities. It's mean the partners come to the table and give something of themselves. And so this is also part of governmental public health agencies really preparing their workforce and getting people to get out of those silos.
So you're going to hear a little bit of repetition throughout this session, but we want to keep going back to what are considered the core for a master's of public health. And we're going to go back to 2006, and the competencies are reviewed and updated every few years, but you're going to see the same idea throughout. So the 5 core disciplines of public health that they took a look at first, that absolutely were there, were biostatistics, environmental health science, epidemiology, health policy and management, and social and behavioral sciences. Those were the disciplines that they draw through. And then there's 7 interdisciplinary and cross-cutting areas, including communication and informatics, diversity and culture, leadership, public health biology, professionalism and ethics, program planning and systems thinking, with international and global health as a specialty track. Again, this is going to sound familiar, but it gets the foundation competencies. The numbers are important. Evidence-based approaches to public health and healthcare systems, planning and management to promote health, policy in public health, leadership, communication, interprofessional practice, and systems thinking. Let's take the first one, evidence-based approaches to public health. This means applying epidemiological methods to all the different settings that you might encounter in public health practice. Use both qualitative and quantitative data collection methods. Analyze that data using biostatistics and all the different ways, the software that we now have available, and interpret the results of data analysis for public health research, policy, or practice. And, you know, as someone who first saw these, I said, well, of course you analyze and interpret, but those are really different functions that are all part of the process.
The next one is, again, so we're basically looking at the 8 areas, and then we're looking at more specifically the competencies within each of them. So this one is public health and healthcare systems. And so the 2 here are compare the organization, structure, and function of healthcare, public health, and regulatory systems across national, international settings. In Maine, you're going to say, well, why would we need to compare with national? Because, you know, most of public health funding, quite a bit of public health funding comes from CDC and other entities at the federal level. And so we need to know what those structures are. I know if you get a grant, for example, from CDC, they don't know what Maine's infrastructure looks like. So we need to know that and what the partnerships are working with healthcare. As far as international, that's important too. We're seeing that now, obviously, with COVID. And in the borders, we certainly in Maine border New Brunswick and Quebec, and we see some issues there with some of the outbreaks that have happened up in Washington County and Aroostook County as far as those kind of connections. Number 6, discuss the means by which structural bias, social inequities, and racism undermine health and create challenges to achieving health equity at organizational, community, and societal levels.
Planning and management to promote health is fairly sizable and does require a certain amount of capacity to pull it off. So again, part of this includes assessing population needs, assets, and capacities that affect the community's health, applying awareness of cultural values and practices to the design or implementation of public health policies or programs. I saw one comment about the definition of community health was that different communities have different definitions of what health is itself, so that we can't even make assumptions without checking into those cultural values and practices. Designing a population-based policy is much different than designing policies for individuals. And is a whole different orientation. Basic principles and tools of budget and resource management are critical. That was the APHA president just mentioned. She'd like to see stronger training in this area and to choose methods to evaluate public health programs.
The next area was policy and public health, and there are 4 sections under this. Discuss multiple dimensions of the policymaking process, including the roles of ethics and evidence. We're going to spend more time on ethics later on, and so there is quite an importance of understanding public health ethics and how we work with partners and with our populations. Propose strategies to identify stakeholders and build coalitions and partnerships for influencing public health outcomes. This is certainly something that happens in Maine a lot. we build coalitions across the board every time an entity, a new strategy comes out. For example, Alzheimer's and dementia just came out recently, and how we went out and looked for folks to identify bringing the right people to the table to talk about how best to prevent Alzheimer's and dementia. Advocate for political, social, or economic policies and programs that will improve health in diverse populations, and evaluate policies for their impact on public health and health equity. I will say it's interesting enough, and again, as Chris mentioned, we're seeing some overlap on a lot of things, but boy, just in this page alone, health equity and diverse populations comes up, and really understanding how public health is really responsible and needs to be accountable to all the populations out there.
Leadership is critical in terms of both leadership, governance, and management. And that really is key. There's nothing more challenging than having a nice concrete thinker who looks to check off the next box and call it done and move, rather than moving towards a broader vision for what we could do and have, including here in Maine. So it's about creating a vision, empowering others, nurturing collaboration, and guiding decision-making, and also applying negotiation and mediation skills to address organizational or community challenges. Certainly the whole issue of vaccination right now has been in the forefront in Maine. In terms of communication, it's about choosing the right communication strategies for different audiences at the right time. And that includes sectors which use different communications. Using audience appropriate public health content in writing and through oral presentation. A number of us always agree we need more plain English materials and messaging than we do. And again, the importance of cultural competence in communicating public health content.
And the final two are interprofessional practice and systems thinking. And in this case, interprofessional refers to engagement with professionals outside of public health. So again, it's really making sure that you're breaking down the silos, not just in the government or in your organization or in your community, but look for those other professionals out there that could really add a different perspective. So under interprofessional practice, the competency is to perform effectively on interprofessional teams. And I think sometimes we think, with all the Zoom meetings we're going on, what does that mean? Does it mean I'm just showing up for a meeting, and at the same time I've got my camera off and I'm doing 5 other things, or does it really mean that I'm really working hard to be part of that team and really understanding? It's really hard. I mean, we've got so many things going on in our lives as far as public health and our own personal lives as such. But it's very important when you've been asked to do it in an interpersonal a team like this, that you really provide as much time as effort as possible. And the last one I think is the most important, and we see a big issue here around systems thinking. People get very much, and I'm going to use the word siloed again, or programmatic, or they get into their own area, and that's important. They've got grants to be accountable to, they've got managers to be accountable to, but they got to think out of the box sometimes. And we need to have more systems thinking around public health issues. And that sometimes means, again, thinking outside, thinking of other partners that are involved in this.
Yes, and after you two have gone through that entire long list and considered whether or not you're interested in public health, maybe you too could actually be a public health nerd, so that you quote the health statistics at dinner parties and you offer your safety tips to loved ones, and you feel passionate about a healthy population. And there's sometimes, I know on a number of occasions, somebody said, well, why do you do this? Or why are you working so hard, whatever? And you're so busy in doing all these things. And it could be me saying it, it could be many other of my colleagues, but people will say, can't help it, born that way.
One of the subliminal, I've just noticed, I've been seeing, I saw this graphic a few times, and now subliminally, I'm seeing that the woman is actually practicing, I think she's eating some kind of vegetable. So that's kind of cool.
Yes.
So this slide is very busy, and it's really, we're not going to spend a whole lot of time, but we do know that there are discipline-specific competencies. And so here is just a short list of the ones that are out there, and you can certainly, if you're in one of these fields, you can certainly, they all have links. We didn't put the links here. We felt if you were that, excited about one of these areas, you can certainly just go into Google or whatever search engine you use, and you can search for these. But there are certainly competencies and guidance documents out there around competencies for these different areas. And we don't have them all here. There's certainly other ones that we can certainly bring up also.
I'm a certified, or I was a certified health education specialist. Again, even though I didn't have an MPH, I actually qualified for academic courses based on the type of academic background that I had. And that allowed me to then sit for the CHES, the certification exam that eventually awarded me that. So there, if you don't have an MPH now, there are still ways of getting in and really focusing on whatever your passion is.
So the Public Health Foundation created a document around these different types of competency skills. And we pulled out a couple of them. These are self-assessments. So it's basically, there's a booklet that you can go, it's at the bottom of the page, the link there. And you can look at these. And we're going to give you a minute or two to take a look at this one. We pulled a couple out just to give you an example. So this is what you would do if you went to that site, it's online. It would actually have a drop-down menu there next to each of these columns, and then would give you a score. So what's the question here? To what degree are you able to effectively engage in, number one, population diversity? So describe the concept. Can you describe the concept of diversity, and can you describe the diversity within a community? And the scoring would be none, I'm unaware or have very little knowledge of this skill. 2, aware, I've heard of it, but I have limited knowledge. 3, I'm knowledgeable, so I'm comfortable and ability to apply this skill. And 4 is proficient. So we're going to give you a minute here. We'll actually be quiet. Too bad we don't have Jeopardy music in the background, but this is for you. Just go ahead and complete this, read these over, and we'll be quiet. This is not a test. We're not going to ask you for your scores. And if, in case this might be a good time also, if you have questions, you can certainly put those in the ask file too. So we'll give you about a minute here.
How about 45 seconds?
Yeah, that's fine.
I'm looking at the clock.
Yeah, I think we're doing pretty well, actually.
Yeah.
Okay, we're going to move on to the next slide. Again, you can certainly go to this link down below and see this again. We'll have a few more slides so you can get a chance to try it again on a different competency. And again, it's just giving you a flavor of what's out there.
But we did want to point out that besides the possibility of being a nerd, you can be totally involved when you're a public health specialist. There's one thing is you're never going to be bored. Things are always changing. The environment is always changing. The funding is always changing. The issues are always changing. And there's not just one issue, but there's multiple issues. It's kind of like the spinning plates in the air. So one of the things that people will say that they like about getting public health training and roles is that there's so much to do, so much, you will never be bored, promise.
And the more education you get, the more you feel that you're not really educated. It's kind of interesting, but
wanted to actually talk about core values in public health. Because it's not just a matter of checking off the boxes of those skills. It's also about bringing your whole self to the work. So that includes the values of professionalism and building trust, of that you are committed to health and safety, to health justice and equity, interdependence and solidarity. What that means is we're all in this together, and we understand we are not isolated individuals. And every time you hear people talking about how they don't want to wear a mask because they're fine, it's a good example of how, you know, that's not necessarily what we're looking for. We are committed to human rights and civil liberties, and we are committed as well to inclusivity and engagement, not only for those who are socially isolated, but also including the hard to work with. They've actually looked at ethics in public health practice, and they're different, they're overlap with, but are different than the ethics for public health research or in medicine, which often are very focused on individuals. But here, our values are a pursuit of the collective good, a focus on prevention, and our belief in the use of either government or collective action to be able to solve a problem. In other words, we address problems that that people cannot solve individually. It's not enough to simply say, okay, please don't smoke, but there needs to be far more involvement. And finally, the practicality. We are practical because we emphasize an outcome-based approach. Social justice, as you saw in equity in the 10 essential services, has basically been defined by public health ethicists as obligating public health to improve any social condition that prevents people from maintaining a standard of life adequate to maintain health.
And so on the last 2 pages, we've actually, I'll go back one. There's certainly some great citations at the bottom that this presentation will be available. So you can certainly go, this page here is on APHA, the American Public Health Association on Ethics. And this one here is a book that Chris diligently read quickly for our presentation to get all her information out of it. And it's a great little book too to take a look at. So here's the second assessment that we're going to do. We only pulled out 2, and this is on public health science skills, which, you know, a good number of people sometimes, this is something that's maybe a weakness, unless you're an epidemiologist or a toxicologist or, you know, have gone through and done environmental health. So we'll take another minute or so here to have you read this. There's a few more here, and we'll have you think through these questions here. We'll give them a minute this time. It's a little longer. 44. It's great to see, especially in science, that they have a section on ethics and research. It certainly, if you go through the MPH program or other public health programs, and there's a whole section on research ethics, the IRB process, and all the importance there, especially if you're working with human subjects in your research. Public health practices sometimes doesn't have to do an IRB, but sometimes it does if you're doing questions that could get at some private information. So having some ethical background in public health is really important. Okay, hopefully you got a chance to get a taste of those things and got yourself a score. And again, this is not a test; it's really a self-assessment, and which can certainly be used by you to improve, find some skills. So we did want to talk a little briefly. I got 2 slides here on one of the graduate degrees that doesn't get talked about much, and that's the Doctor of Public Health. And similar to the Master of Public Health, there are some foundational competencies. Just like the tier process and just like a number of other processes, the Doctor of Public Health builds off of the Master of Public Health competencies. So you need to meet those competencies first. And then additionally are these 4 areas. Data and analysis. So typically a Doctor of Public Health person should be able to look at a graphic, and even if they haven't done that research, they should know basically how to read that data and analyze it after reviewing it. They should have skills in leadership, management, and governance. Um, Certainly be able to understand policy and how to use data to create policy, how to understand how to use mitigation and such to develop policy and get, legislatures and others to work towards a policy, and also in program development. And the last one is around education and workforce development. And a leader should be an educator, someone who's leading by example, but also by really saying the right things and having some knowledge about what is public health and where you want to go. And again, this is this information that we did not go over the 20 competencies like we did for the Master of Public Health, but you can certainly find those broken out by these 4 core disciplines. And the citation is at the bottom if you want to take a look at that. That's at the I can't remember the CEPH, and we'll get to that in a minute here. So what is the Doctor of Public Health? Some folks think this is a PhD program, and it's actually not. It's a professional doctoral degree in public health. Professional here mean more practical. So it's basically, instead of a thesis, and though some Doctor of Public Health do a thesis, they typically are doing policy, documentation, or some type of a practicum that develops into a new type of procedure or a new type of leadership. So it's a professional doctoral degree in public health. It produces transformative academic and practice leaders with experience in expertise in evidence-based public health practice and research. What's the attributes? And some of you are going to say, geez, I do some of these things already. Maybe I should get a doctor of public health. They convene diverse partners. And convene here is actually a fairly simple term. It's convene, but it's because of their understanding of the folks that they're bringing the right people to the table. They communicate to affect change. That's a really important one. It's not just communicating, but it's really looking at those behavior changes, that the policy changes that are important across a range of sectors and settings. They also have a great ability to synthesize and translate findings in an easy understanding from all different types of audiences. A great trait and a great skill that a lot of people don't have. They also generate practice-based evidence that advances programs, policies, services, and our systems addressing population health.
So we're going to list some educational opportunities in Maine. And if we've left something out that the audience feels should be in here, we're certainly willing to add in. But we're really not talking just about workshops here. We're talking about learning programs. And so, and appreciating that public health has a very strong academic foundation. I actually remember talking to somebody who, before there was any public health program in Maine, used to take a bus down to Boston in order to work towards her MPH. We literally didn't have anything until the last few years. But at present, we have the University of New England Public Health Programs, has both a BS and a master's, as does the University of Southern Maine through the Muskie Institute. And there are public health institutes who have formally worked to qualify as members of the National Network of Public Health Institutes. So happily, we have both USM, again, in the Muskie School specifically, and Medical Care Development also has a public health institute affiliated with NNPHI. There are other programs that are offering education within Maine, based at UNA, but having a Maine area health education center, which is federally funded, which helps support health workforce education. And there are satellite AHECs throughout the state of Maine. It's also affiliated with the New England Public Health Training Center. And again, these are free or low cost. And finally, there are leadership programs that bring health professionals together, such as the Hanley Center or the Maine Community Development.
Chris, is that the Maine Community Development Foundation?
Yes, sorry.
Yeah. No, that's okay. Yeah.
Basically, the picture is huge. If you are interested in developing skill sets and competencies in public health, there's almost every kind of variable that can be shaped to what your lifestyle and needs are. So in higher education, there are both undergraduate and graduate degree programs in public health, but there are also public health certificates, which is fewer than the full degree programs, but nonetheless will give you a great grounding in public health. There are accelerated programs that take you through BS to an MPH pretty fast. And there are joint degrees, MPH law, MPH social work, MPH medicine, MPH in environmental science. There are on-campus and online options, and there are full-time and part-time options. Public Health Train is an enormous database of courses, both free and for charge. And you can set up your own sort of curriculum there, and it can track and help you track all the courses you plan to take and complete. And they can tell you which ones you can get continuing education credits for. Because basically public health is about lifelong learning. There's always new things to learn. There's also an online set of courses at Coursera. Again, I talked about lifelong education and chess. Here's some examples. If what floats your boat is social justice, you can get certificates in social justice or global health or climate adaptation or LGBT health, tribal health, environmental health. Population health is actually a certificate program based on the public health competencies for people who work in hospitals. And there's also prevention certificates.
And certainly, we probably don't have them all here, but certainly one that pops up to me is, public health especially works a lot with emergency preparedness. And so there's a whole other area, another slide we could do just on the connection between public health and emergency preparedness. Um, and so that's, there's FEMA courses, there's a lot of other courses, and certainly working with MEMA, which is our main emergency management agency, as well as your county EMA, great resources to talk to about trainings and some of the things around that.
And I forgot to mention that community health workers
Oh, yeah.
can get certificates. There's not one standardized certificate, but they're in the works. And if anybody has any questions about that, you can check with one of us afterwards. I know Medical Care Development Public Health actually offers a CHW certificate program.
And just briefly, if you've not heard of Coursera, that was put together by major universities in the country, and taking campus courses that some of their professors put together, and they put them online. And so there's a full curriculum there. Some courses are free, some are not free, but you can certainly go in there. Similar to the public health train, you can set up your own curriculum. It tracks for you. It sets up the coursework, and there's full curriculum, there's tests, there's a lot of different things, live lectures that have PDFs and other things. It's just really lined up very well. So those are two great things to take a look at, if it's, especially these days when there's not a lot of in-person activity. So something online is really a good option. We added this because we do want to talk, both of us coming from governmental public health, um, that there is a connection between all these competencies and something called public health accreditation. And so, as you know, Maine CDC went through accreditation process. We were accredited, what do I want to say, about 3 years ago, I think, and we're in the midst of reaccreditation process. But this again is setting standards for governmental health departments at all levels, typically at the state, county, and city level. It increases accountability and visibility, but the connection to the competencies are really shown in the areas under the stimulates new attention. So we've talked about the connection between competencies and workforce development, competencies and quality improvement, the planning processes, health equity, all the surveillance and data issues. And really being ready to go with anything emerging, you need to have some competencies to be able to respond. So that's where the public health accreditation connects with the competencies. We don't have necessarily a reference page because we put the references within the slide presentation, but we did want to give you some links to some of the more the ones that we looked at, and certainly some of the folks that are out there. So the Association of Schools and Programs in Public Health is actually a place that if you wanted to look up a school and their programs, they're all listed there, their members. And we're not going to get into the specifics, but there are some key points of difference between a school of public health and a program of public health. We'll let you figure that out. We don't want to get into the political mess there that could certainly open up a can of worms. But both are accredited, and you can see there what fits best for you. The Council on Education for Public Health really looks at um, the folks that really look at curriculum and really figure out what the future is of public health. So there's some great things there. The Institute for Public Health Innovation is really the entity out of CDC, and they're connected to a number of other national public health groups, NACCHO, ASTO, and they were set up basically to start looking at public health in the future. And they were some of the folks that really brought together the changes or the revisions of the essential public health services. And certainly a major foundation working in public health is the Robert Wood Johnson Foundation. And this link here is really around their healthy communities and the county health rankings. So you can go there, but certainly go all through Robert Wood Johnson Foundation. Some great activities are going on there as far as, and also grant opportunities for folks, not just for organizations, but for individuals. They have a lot of great things for fellowships for individuals if you want to look into that area. And with that, we're going to say thank you very much for your time. I'm sure there might be some questions. There's our contact information if you want to get a hold of us. And I think we thank you very much for this time. And I think, Ellen, there might be some questions for us. possibly?
Yes, I do have a couple of questions for you. Thank you so much for that presentation. First, I want to do a little plug for UMF because I noticed on that educational opportunities slide, so they do have their community health program that teaches directly to the CHES competencies.
Great.
And with that, I want to ask what the difference, on your end, is between a community health program like that and a public health program and meeting the public health competencies.
I was actually went to their website the other day to double check. The degree that you get is, I believe, a bachelor's in, it's applied science or something like that. It's not a public health degree, but yes, UMF is doing fabulous work in producing extremely well-trained community health specialists, and couldn't be prouder. Prescott used to have one, but I just checked and I couldn't find their degree program the way it used to be. So if we start moving into there wasn't enough time to start going into all the certificate programs. So we decided to be, but thank you for advocating.
Yeah, and I will tell you, I for the last 2 years, the University of Maine Machias has actually looked at the CHES certificate, and we're actually developing a curriculum at Machias. I'm on the team there because I would be teaching some of the courses, but we're looking at a type of a preparation for their School of Psychology and Applied Community Activities, and they want a public health side of that. And so we're looking at a public health and using the CHES model as a potential for them to get that certificate as when they graduate with a bachelor's degree.
Excellent. Thank you. It's great to hear all the different avenues that are happening in the state for educating our workforce. We did have a question about if there were any Doctor of Public Health programs here in Maine.
I can't speak for the universities right now on their websites. They're not listing them. That there are not a lot of Doctor of Public Health degrees, and a good number of them are actually you have to be on campus, even though in this day and age they're probably moving to virtual. But there were only a few that were considered online. I think Emory had an online Doctor of Public Health, the University of Illinois at Chicago, Johns Hopkins, and North Carolina, University of North Carolina had online Doctor of Public Health programs. The other ones were in person. So I think Boston University has a doctorate program, but it's in person. Now, that's what they say right now. They're probably going to be moving those to virtual down the line. I think Tulane's got a on-site place, and there's a listing. You can certainly go and find the listings, but Maine doesn't. I think the closest one we have is probably in Massachusetts. Harvard. Harvard doesn't actually have a doctor of public health. They have a PhD program. They might have an executive program, but I think I'll have to look. I can't remember offhand, to tell you the truth.
Perfect. No, thank you. All right. One more question I have is about the public health institutes and what that distinction is, kind of what work they do, how they work with the state government.
Yeah, I'll let. I know Chris found those, and certainly there's a listing when you become a member of that national program, and so I'll turn it over to her because I think she looked at that a little more carefully.
Yes, the institutes have been wonderful. They work with state governments and other organizations to do some of the work that a state agency either might not want to do or may not be able to do. We actually, MPHA was advocated for a legislative bill that proposed that that Maine establish an affiliation between the Maine CDC and a public health institute. We had Muskie step forward and offer that. And some of that came out of the fact that there was money coming out that we could have applied for, but the administration we were working under at the time was not supportive. And it would, to be able to have an institute, you could have the institute apply on behalf of the state agency and manage the money. And that idea was very exciting. Unfortunately, we had, or fortunately, we had, I think there was about 6 or 8 entities who felt that they could do the job as well, who were not formally had passed qualifications to be a member of the national network. So as a result, the bill died. But they sometimes do offer trainings. Again, they need the money for it, but they do trainings, they do research projects, do a variety of things, but they're not a governmental agency.
Yeah, and I would add to that that they're probably, as she's mentioned, public health agencies or state agencies, county agencies, typically cannot apply for research type money because they're a public health practice. And so they'll use an institute or a college in their area, university or research institute to do that research. So they have an idea, but they bring that research institute to apply for those other type of grants to look at things. When the Environmental Public Health Tracking Program started about the beginning of the 2000s, many of the states did that. I know New Mexico used the University of New Mexico, and they actually applied for the state public health agency in a collaboration type thing because they wanted to do a lot of research projects. So they applied for the actual public health tracking grant along with the state agency. So those kind of things are great to have because it offers more opportunities for different types of grants. And it also builds your public health practice so that you're actually doing research to see if things are actually working. And again, we've talked about collaboration and thinking from a systems perspective. And having an institute working with both a department and a public health agency makes a lot of sense.
Awesome, thank you. And then one last question regarding Director Shaw's talk about conducting an assessment of public health infrastructure during his keynote presentation, and wondering if you could talk about how these competencies relate to those types of assessments. Or not.
No,
Yeah.
they
Go ahead, Chris.
They definitely do. Again, these were these in-system assessment instruments were developed fairly early on. There was an earth-shaking report that came out in 1988 on the future of public health that basically said, you've seen one public health department, you've seen one health department, you have no idea what they're doing necessarily. There's no standardization, there's no sort of formal competencies. And among the conversations that happened as a result of that was the idea of taking the 10 essential services, understanding what the role of either the local public health department or the state public health department is, and looking at what their roles are and then how they see that those services, the public health, essential public health services, are delivered at the ground level. So the assessment in both cases is to take all the key partners who play a part of a public health system, bring them together and have them do some to basically answer questions and self-assess how much they contribute to the system delivering that particular service. And when we conducted the local public health system assessments, for the first time in 2009. It was just so much fun listening to convening people who didn't think they were necessarily part of a public health system, and then having those people, when asked the questions, find out they were all working on one aspect or another of the issue, and sometimes duplicating. And so it's an amazing opportunity to evaluate the coordination and linkages, because again, what you're looking for is to strengthen the system capacity, not just what each individual agency does, but rather to see how functional it is.
Yeah, and
Al?
just to build on what Chris said, certainly there are two instruments out there. One's called Local Public Health System Assessment, which the district counts the public health districts are using right now. They started pre-COVID. Some of the districts actually has had a couple of meetings where they were doing that, and then COVID hit, and we've had to suspend those for the time being or postpone them. They will come back at a certain time. The State Public Health System Assessment, there's a committee, we just met today, in fact, composed of district liaisons and community members and some folks that are on the statewide coordinating council. And there's an instrument for that also. And again, it's called the State Public Health Systems Assessment. And so some folks hear that and they think, oh, that's the China, the Community Health Needs Assessment. No, it's a totally different process. That's looking at data and really getting people to look at the gaps of services that have to do with that data. The systems assessment is looking at each of the standards, the essential public health standards, the services, and asking questions about each of those. And as Chris said very well, at the district level, you're looking at certain partners who work intermixed in the district. Those could be community coalitions, they could be district-wide folks. There may be some state folks there. At the state level, it's really who are the partners that work with the state. So you're not going to have someone necessarily coming from Calais to Augusta for a state public health system assessment, because their perspective is not at that state level. They're not necessarily a state partner. So we're still working on the state public health system assessment. We're looking to see if there's going to be an avenue around one of these days when COVID sort of settles down, and we'll do it. I think right now we're looking at a potentially for a virtual type of one. No one has done that before, so we're trying to figure if that's the way to do that. I will tell you, and if you have not been in one of these systems assessment, they really build off the audience. So it's really people discussing and bringing different points of view, and then getting a consensus view on each of those areas. And so having the audience participate and having that discussion is really important. I'm not sure virtual can do that. We're just really unsure if that's something that we can really accomplish. So we're still figuring that out.
All right, thank you. With that, we are at time. And I want to say, if any other folks have additional questions, please feel free to reach out directly. That's Al and Chris's info. And we really, really appreciate you joining us today. This was a really excellent session. We appreciate your efforts and for being with us. And I want to say thank you to all of our participants as well. And remind folks to please complete the session evaluation. We will be back shortly with a panel presentation about medical screenings and community response, and we would love to have folks join us. So thank you so much, everyone.
Thank you, everyone.
Thank you, everyone.